Somewhere in America, a phone is about to ring.
Welcome back to Shared Humanity. My name is Nelba Márquez-Greene, and in this podcast and video series, I talk to the humans behind the headlines of gun violence in a moment in history where all too often we focus on everything but. May these stories give you new perspective and empower you to hope and action. Welcome back to the premiere episode of Shared Humanity Season 2. We ended, if you remember, our last season with an interview with Dean Rennie. And Dean Rennie shared with us the foundations of public health and looking at gun violence as a public health issue. And she also shared with us some of her hopes and her dreams. And her hopes and her dreams included expanding the firearm injury prevention team at the School of Public Health at Yale. And that's why we start this season with Drs. Cerda, Drs. Raissian, and Dr. Morrison. And they are all here as manifestations of that dream and that hope. And they are our newly established leaders here at the Firearm Injury Prevention Initiative and beyond. So much has changed since our last interview with Dean Rennie in our world and in our school. We previously featured her, like I said, and today we are just so fortunate to have these three leaders that we can talk to. I will direct this question to all of you, and you can decide who goes first, but if you can tell us who you are, what your background and specialty is, and what your role is at Yale, that would be a great place to start, I think. Who wants to go first?
I can go first. I'm Magdalena Cerda. I'm currently the director of the Division of Epidemiology at the Department of Population Health at NYU Grossman School of Medicine. But as of July 1st, I will become the chair of the Department of Chronic Disease Epidemiology at the Yale School of Public Health. I'm very honored and excited to take up this position and opportunity, and the opportunity to work with the Firearm Injury Prevention Initiative and everything that I think we can do together to build work on injury prevention. I'm trained as a social and injury epidemiologist, and I do research on the social and policy drivers of drug use and urban violence.
Thank you. Thank you so much. And are you at your office right now? I could hear the sirens in the background. Gives us some context. How about you, Dr. Morrison? Why don't you go next?
Sure. I'm formerly on faculty at Columbia University. I trained at Monash University in Australia. Much like Dr. Cerda, as a social epidemiologist focusing on injury and violence prevention. I've worked in spatial epidemiology for many years. And my role here, I'm coming in as the scientific director for our firearm injury prevention team, working to help build out the research portfolio in this team. And I'm really thrilled to be here and to be working with you all.
So sometimes people who listen are people who work in public health, and sometimes people who listen are people who are still trying to figure out what public health is. And for those folks, what is a spatial epidemiologist? What the heck does that mean?
Yeah. We work at the intersection of geography and statistics and health. So if you imagine a Venn diagram with all of those things, we build maps of where people are injured or have health problems of some description and try and understand how and why the maps look like they do. And that involves using all of the same types of epidemiology that we see. We all got very familiar with epidemiology during COVID. We use many of the same methods that we used during COVID and to try and understand all sorts of other health conditions. We apply those same methods to try and understand how and why maps of, in our case, firearm violence look like they do. Because if we understand that, then we can do something about it.
Excellent. That was a nice summary. And how about you, Dr. Raissian?
So hi, it's really, really lovely to be here with this team. I've come into this firearm injury prevention team as the executive director of our team, and part of my job is to to be a researcher, but also to help link the work that we're doing to society. It's that part of our Yale School of Public Health vision, which is to link science to society. So learn and hear what we're doing, and then really make sure that's getting to the different constituents that might be interested in our work or learn from our work or improve our work from the beginning, and to really sort of make sure that that work is going full circle. You asked how I came to this work. Honestly, by accident. I did not ever mean to become a researcher. That was not my plan. I was a victim advocate for domestic violence victims in a district attorney's office in Davidson County, which is Nashville, Tennessee. And through a sort of series of events, I wound up going back to school and decided very quickly that what I wanted to do was to become a researcher, to take the questions I'd had as an advocate and try to understand what, if at all, criminal justice interventions were working, or working the way we intended, or were they working in a way that was opposite our goals for public safety. And so through that, I've sort of become a crime/health economist. And we try to think very deeply about cause and effect and research designs and data that would allow us to say confidently that an intervention or a policy has had a particular effect. So not all economists are thinking about the stock market all the time. That's not my brand of work, but it fits in really nicely with the kinds of work that Dr. Morrison described and Dr. Cerda is doing, and so many other people on the team. And so hopefully I can be here to help leverage those strengths.
That's amazing. Thank you. Is it okay for the rest of the interview if I call you Chris, Kerri, and Magda? Is that all right?
Absolutely.
Lovely.
Yes,
Okay.
please do.
Perfect. So you all took this job, right? Dean Rennie had this vision, and she's like, hey, come work at Yale and help me do this, right? Just kind of like how she did with me. And in the meantime, simultaneously, the world is changing. The landscape of both firearm injury prevention and just general politics and research funding and all kinds of things, they're all changing. What are the challenges and opportunities? Can you list some, or some that you want to talk about in the moment right now in your sphere of influence and with the specialty that you carry? Maybe we can start with you this time.
Sure. Yeah, yes, there are lots of new challenges, and the world is evolving very, very quickly. And I come back to the guiding principles for the work of social and spatial epidemiology, which we like to describe as one of the core sciences of public health. And those are things that don't change. The two guiding principles that I often come back to are, first, that there's no simple solutions for complex problems. We're never in the business of trying to find the one thing that works, the one thing that will solve the problem. That perspective suggests that there's many very complicated, very complex solutions for the social problems that we study, and firearm violence is no different. Sometimes we're studying things that are immediately relevant. Sometimes we're looking back over a whole nation or over decades or even hundreds of years to try and understand why problems appear the way they do. So that doesn't change in the day-to-day. That fundamental principle doesn't change with the political cycle or with different funding opportunities that might be available. The second guiding principle that I take to this work is that we never know who we help. In prevention science, that's often a problem for the work that we're doing, is that it's very difficult to know precisely whom we've helped if we change a policy or implement a program. If we're working at a population level, then the results of our work are a change in the overall. In the case of spatial epidemiology, it means that the map might look slightly different, but we don't know who it might be who would have been on that map had we not acted. And that's a common issue for the work of prevention. And when we pair that with the suggestion that there's no simple solutions for complex problems, then it means that the work that we do, that we take to injury and violence prevention and public health generally, that we can anchor our work in the fundamental principles that have sustained us for many, many years. We don't need to change that aspect of the work. Some of the momentary structures and some of the ways we communicate our work, certainly that we need to have the finger on the pulse to understand how to implement that work. But at a very base level, the work doesn't change.
I'm glad you talked about how we communicate our work, because you talked about these complex problems not having simple solutions, but we are a world that is increasingly crying out for a simple solution. Give me the immediate fix. So how do we teach people that there is no simple fix for a lot of our most pressing problems, including gun violence? How do you do that using science?
That's the challenge. That's the challenge. And it's something that epidemiology and public health has been wrestling with for a very long time, because the way that we're trained to do this work is with this sort of instinctive understanding that complex problems like this have solutions that can take a very long time, with many people working towards those solutions. How we share that message is something that we haven't done well for many years, and I include myself in that. I'm pleased that that's a renewed focus on the field, and it's really one of the reasons why I'm thrilled to be here, because it's such a core focus of the work that we're doing here, is not just doing the science that needs to be done, it's sharing it with the people who need to hear it.
I'm so glad you brought that up, because it is a core. What's the point of doing all this if we're not sharing it with communities that most need it? Magda or Kerri, who wants to go next?
I can go. So for me, I think, right now we're going through a lot of challenges in public health. Challenges with federal funding, both of programs and of research, and funding for, that kind of defines the kind of research that we can do. This is a particular issue for firearm research, firearm violence research. And, we're seeing cancellation of research projects, threats to closure of programs, restrictions on the types of services that can be funded. So I think that's a huge challenge that we need to face, and that I think we have a role to play in addressing as scientists. At a broader level, I think there's also a huge national problem, which is that although in this country we spend a ton of money on healthcare, in fact, I think we're one of the countries that spends most on healthcare, people in the United States die earlier than people in comparable countries. So just to give you an example, in the US, 1 in 25 5-year-olds won't make it to their 40th birthday. And so that's truly unacceptable. I think it's a huge challenge. And it's really due to 3 things, mostly, in addition to others, but firearm violence, overdose, and motor vehicle crashes. So I think that's a huge challenge. And that's something that I'm hoping with this initiative that we will be able to address these cross-cutting problems of gun violence, overdose, and traffic crashes. At the same time, I think there's some good news, because I think for a lot of these, we actually know what works. So like, for example, take violence, right? So take community violence. We know that, for example, making it more difficult for people to carry guns in public, investing in the built environment and creating safe and well-lighted public spaces and housing, and creating spaces where people can get together and watch over the neighborhood and intervene in times, where altercations come up, building both formal and informal sources of social control in neighborhoods, and, investing in programs that help kids respond to perceived threats in a nonviolent way. We know that all of those work. And probably, like what Chris said, is, none of them are the magic bullet, but, investment in all of these together, we know works to reduce violence. But, we still have a huge problem. So where do we go from that? We know what works to how do we address it? And I think our responsibility as public health scientists is to figure that out, to figure out, who's most affected by these public health challenges, what types of approaches will work best for each population. Probably the same solution won't be relevant to each population. And I really think a key challenge here is we may know what works because we've done a randomized controlled trial, but there's a long distance from that randomized controlled trial to what actually gets scaled up and implemented and works in a community. And so how do we figure that out? How do we scale up to ensure investment in interventions that are sustainable and that are implemented in a way that has community buy-in and that are effective for the community that is served. So I'm really hoping and I'm excited to work on these challenges together with this team.
You brought up research cuts, funding cuts to research. And I think, I can't remember who this quote is from, but I remember this quote. It's like, public health, when done well, is invisible. And that's part of the issue, right? People forget that these things, whether it's evaluating interventions or running programs or even, so many things that we do, it costs money and someone has to pay for it or we can't do the work. And yes, public health, when done well, is invisible, but it can be invisible, but it can't be unfunded. And that's a huge challenge. And thank you for thinking of some positive things as well. And dropping those statistics, right, on the, so you said really quickly, firearm violence, car crashes, and overdose. And
Yep.
drop that statistic one more time. 1 in 25?
1 in 25 5-year-olds don't live to see their 40th birthday in the United States.
In the United States.
Yeah, in the United States. And that's substantially higher than what we see in other comparable countries.
Yeah, we really need to make sure we get that out there as well. Dr. Raissian, it's been a little bit since I asked the question, so let me ask it one more time so you have it at top of mind. The landscape of public health within the Firearm Injury Prevention Institute and just globally, the landscape period has changed. What are you most excited about? And what is the biggest challenge right now?
So I echo so much of what Chris and Magda say. I think, though, as someone who thinks about domestic violence and family violence and the health of the family, things change, but that has stayed the same. Healthy families are really important to a healthy society. And unfortunately, in the news over especially the last month or so, we've had just some really horrific examples of domestic violence becoming deadly, often with firearms. Sometimes there were warning signs, sometimes there were not. And of course, those are the ones we hear about. There are thousands of families suffering from violence that we may never learn about, or that we may learn about in a horrific headline. And so that's hard for me to sort of hear and digest as someone who's really been working in this field for, since she graduated from college and even before. To see that sticky problem is hard. And we see, violent crime, especially homicides, going down in the United States, except domestic violence homicides seem to somehow be immune from that. They don't seem to be going down at the same rate as other community-based firearms or other firearm homicides across the country. And so a question is why? And that creates a challenge. I don't have an easy answer for you. To echo Chris, I don't have an easy answer. What is exciting from that, though, I just returned from a conference in Salt Lake City, Utah, which was the Association of Prosecuting Attorneys National Domestic Violence convening. I think they're in their 7th year of convening that meeting. And I was able to present not once, but twice about research partnerships with prosecutors across the country. And both times the rooms were filled. And so, what is heartwarming and somewhat motivating is that people do want research. People do want to know how to improve their work, to improve their practice, to reduce domestic violence, or figure out what they're doing that isn't reducing domestic violence. Some of the things we do don't actually work. And if that's the case, we want to discover that quickly and divert those funds to something that does, right? One of my mentors says, look, if we're going to fail, let's fail fast. And I think that research can help us do that. It can help us fail fast. It can help us succeed and build, right? But it's that information input that's so necessary. And we can't get discouraged when we have a finding that's not what we necessarily wanted to find, because at the end of the day, we're about advancing outcomes, advancing that instead of 1 in 25, let's get to 1 in 28, and then let's get to 1 in 30. This is going to be most likely incremental, but hopefully it can be sustained and it can be evidence-based, and we can know the things that are working so that we can continue to do that, as opposed to sort of like, well, let's guess and just hope we guess the right thing and scale and replicate the right thing. And so as like slow as research is, what I'm hoping is that incremental progress is something that can be sustained and built on, so that it can be incorporated into our everyday life, and that those statistics can be something that we continue to build on.
Thank you. Incremental change, rooms and spaces filled with people who are eager to learn and be a part of the process. And I'm going to add one that I didn't hear anybody say yet, and that this feels like a really strong moment of collaboration among different specialties, among different skill sets. And the fact that we're all here right now is an example of that. As a matter of fact, we traveled as a team, Chris and Kerri, to the Firearm conference, research conference, and we presented as a team it was my first time. I don't know if it was your first time presenting with a survivor. Was it your first time presenting with a survivor? Probably not. You all are so into the work, but it was my first time presenting with a group of scientists, and it was pretty terrifying, but I think I learned a lot. Did y'all learn anything, or anything you want to share?
Well, the first thing I learned is not to present after you, because you are an outstanding presenter. And as nervous as you may have been, you did not look that way. So my own first professional tip is don't go after Nelba. It's really hard.
My cheeks are really hot right now. Thank you for saying that. I did not pay her. It was terrifying, but also super fun to feel like you could be a part of something bigger than yourself. And also, if we have this theme of linking science and society, then our science has to include voices of those most impacted. That's another big focus of our team, right? Another big focus of our team is meaningfully integrating voices of people who are most impacted by problems that we're trying to fix alongside, and that's going to take bumps. That's going to take time. Dean Rennie talks a lot about trust, and trust in public health is a really hot topic right now. Anyone can take this, but how do we build trust among most impacted communities in our work?
So I want to just first say that, because I think this is really important and a feature of our team, is that when we talk about the groups most impacted, we mean that in a very broad sense.
Yes.
And I think that's really important. So we do mean community gun violence survivors. We do mean those who've been affected by mass and public shootings. We also mean suicide. We also mean gun owners. We mean non-gun owners. We mean those in the space between. We mean law enforcement. Like, we mean this in a really broad way. And I think that's really important. Part of my role is to sort of help us build that big tent and to really think broadly, because Chris's point earlier, solutions are going to come from a lot of different places, because this problem comes from a lot of different places. And so we have to partner with anybody who's willing to partner. And the beauty is, a lot of people, everybody maybe wants to see less firearm injury, right? That is a common and shared goal, despite where we may start on this issue. And so, part of, I think, what's important for us and has been our our guiding light are two things. One is survivor voices, and the other is the reduction of firearm injury, and really staying true to that. And again, working across different folks and the spectrum, both political when we think of policymakers, people when we think of just citizens, or those out and about, because unfortunately, this is an American problem. I often say, like, every American has a non-trivial chance of being affected by firearm violence, and it doesn't matter where you live. And so we really want to build those partnerships in every single corner of America. And I think at the presentation that you mentioned, that room was full of a lot of different kinds of people that think about this issue very, very differently. And one of the things that's exciting to me about our group is we are excited to talk to people no matter how they come to this issue, and think about research that can meaningfully make their lives safer.
I appreciate also that we can talk to one another. I mean, when you came on board, I was like, okay, how do I talk to a MAP person? But it became clearly evident how we could work together and that it was necessary to do so, but also super rare. Do you have any feedback on our presentation or what that was like?
Yes, and sort of more broadly in context of the work that we've been doing. I think the thing that comes to mind about how to build trust is something that you've taught me, Nelba, is bringing some humility to the work. In the sciences, we champion the people who know things, and we're sort of rewarded for bold assertions and strong declarations about the things that we know. And there's a cadence to the way we speak, and there's some expectations about the way that we present. And when we're presenting to a scientific audience, that is helpful, and often that's the work that needs to be done. But that doesn't work outside of a scientific audience. And in fact, if I'm talking with people who've been directly affected by firearm violence, then that would be quite harmful to claim authority or to feel like I know a problem more intimately than the people who are directly affected. And so coming with humility and offering the work that we can do, and offering to help with adding some scientific structures and to building out an evidence base that might help prevent the problem or mitigate harm in some way, then that's where that partnership can be really fruitful. And that's something that's something that I've learned from working with you, even just within a few months.
Thank you for saying that. There's a quote I really love. It's like, no significant learning can occur outside of a significant relationship. And I think everyone in our work wants to be seen, right? Scientists want to be seen. Survivors want to be seen. Gun owners want to be seen, and they don't always want to be seen as monsters who champion gun violence, right? They do care deeply about their Second Amendment rights or protecting their families. Politicians want to be seen. The importance of being seen, and outside of relationship, we really can't do that no matter what science we have. And I've seen you do that really beautifully in your injury and violence class that you teach here to YSPH students. And you did a series of interviews on the gun violence prevention kind of ecosystem. You started with a survivor. Full disclosure, that was me. And you, your last interview, you actually let your teaching assistant do, and that was with our director of the commissioner for the Department of Public Health. I actually took that model of interviewing folks in the ecosystem, and I'm applying it to season 2 of Shared Humanity. What's your favorite thing about teaching?
About teaching broadly, or about that specific class?
You get to answer your way.
So the thing that I've loved about that class is that we've used a social ecological model, which sort of understands that people are nested within systems, and the borders around those systems are porous. And so we've interviewed a clinician, a journalist, a researcher, an advocate, and the commissioner, as you say. And what's been quite fascinating about the interviews is the sameness to the interviews, in that we're all working together to prevent injury and violence. As Kerri said, no one wants to see there be more injuries, more violence. The ways we have of going about that work are quite different. But it's been quite fascinating hearing two sides of the same story. So the researcher was talking about coming to work with law enforcement with humility, without coming from the position of authority and telling law enforcement what it is that they need to know and where the deficiencies are. And then the law enforcement official came with the same perspective, that when they're interested in working with researchers, when researchers come with humility. And so hearing that we're all running in the same direction, we're all trying to address the same problem. We come about it with vastly different perspectives and different resources and different ways of working, as we find within our team as a little microcosm. And seeing that in action, that's been something that's been quite beautiful. And I certainly didn't plan it that way, but it's something that's worked out to be quite powerful, I think.
That's awesome. Magda, when you come to Yale, will you be teaching any classes?
I will. It's not determined yet what I'll be teaching, but yes, and I look forward to it.
And what's
I
your
enjoy
favorite thing
teaching
about
very much.
teaching?
It's being challenged and surprised by students. So here at NYU, I teach a class called Critical Thinking in Epidemiology, which is around how do we use the methods we learn in epidemiology to critically evaluate the literature and figure out what its current limitations are, and what are the questions we should be asking, and what are the appropriate methods that we should be using to answer those questions. And I've been teaching this class for many, many years, and it's just as challenging every year because, the students come in with new questions. Also, the methods evolve. And so seeing them learn how to apply methods in a new way, that's, not the textbook approach, but actually being challenged and how do you apply them in real life is really hard and fun at the same time. So I think exchanging with students is a way for faculty to keep learning.
That's awesome. Again, following that thread of humility. For our incoming class of students, if they were one of them, a representative was here in front of you right now, and they asked you, I am starting my YSPH career now as a student. What is your best piece of advice moving forward? What would that be?
To really take this as an opportunity to learn as much as you can, and really, take all the courses that you can get, because this is the time, doing a master's or doing a PhD, it's the time for you to actually learn new methods, new theories, new concepts that will probably be much harder afterwards, right? And it's such an exciting time of discovery. And I would tell them that in this time where we see public health under threat, quite frankly, and trust in public health under threat, to keep in the back of our minds that we can really use science for good. And within that perspective, we can use the methods that we learn in public health for good. And so take that opportunity to learn about the best methods. And I think that will really pay off in the long run, because by using rigorous research, engaged with community members, with stakeholders, we can get the right answers to important public health questions.
Yes, yes, and yes. I think going back a little bit to something you all were saying earlier about working with communities, one of the things that should be stated, it can be super intimidating, right? It can be super intimidating for non-academic folks to partner with, as you're talking, right? Look at all of these fancy degrees. Look at this institution. Look at the history of research, particularly the history of Yale, which some of it is amazing and some of it requires work. And also, one of the things I feel and see among our team is that these are not values imposed just on one particular person. Like, okay, the community scholar is going to be the one that links science and society. When Kerri described her work, she started with linking science and society. They are embodied values among our team members. And I do think that makes us different. And I'm super proud of that. I also recognize that this is a ton of work. So on a lighter note, what do y'all do for self-care? What do people entrenched and mired in these problems do for self-care, specifically you three? We want to see the human side of you as well. Kerri, you go first.
I mean, I think the first thing to do for self-care is that, like, you can't manage bad self-care or like a bad work environment out, right? I think is the first thing to sort of acknowledge is that we've all had different jobs, and I'm guessing some of them are, ranked order differently. I think one of the things that helps is that I like the people I work with and I like the work that I do, and I feel supported. And as, part of the leadership of this team, we think deeply about how to create a healthy team, right? Like, prevention is worth an ounce of cure. I think I'm not really a public health person. I'm an economist, but I think that's a saying that you guys have, right? And so the first thing I think is trying to create a work environment that has principles, has shared values, etc. But outside of working in an amazing place, I try to have fun. I try to read and garden. We did family basketball, and I think my rotator cuff, I think I'm a little old to maybe do family basketball, but whatever, we did it anyway, and it was good and it was fun. And I send funny memes to people, right? You have to laugh at the absurdity of the stuff that's around us as well. And I pet my puppies and I hug my kids, and I try to do healthy things. But again, on the front end, you also have to limit. You also have to turn off social media when it gets too much. And you also have to draw some boundaries around your work, because again, there's only so much self-care can do, I think. But it is those good partnerships and also just, I think if you also come to this work with humility, you guard yourself from a lot of just like false expectations around yourself. And that is also really, really helpful. So I don't know. I try to do a lot. And honestly, Nelba, I'm not sure I'm good at it all the time either. So.
Well, the good news is we don't have to be. That's why we work in a team.
We're a team.
Yeah.
We're a team. Exactly.
That's why we work in a team. Magda, self-care?
Yeah, I fully agree with everything Kerri said, and related to the humility, something that I've been told is you're not essential in the world, So if you don't do, that project, nobody is going, at the end of the day, life is going to go on. It's okay. And that means that you can set limits on your work. And that's something I frankly have struggled a lot with, but I'm trying to learn to be better at just setting healthy boundaries and, taking pleasure in life outside of work. So, spending time with my family, with my dog, reading fiction, enjoying, I live in New York City and enjoying everything that New York City has to offer, doing exercise. So, I really don't have it down pat right now. It's definitely a constant struggle, but I think that humility has really helped me in setting boundaries. And I also agree about the work environment. Like I love coming to work every day. One of the things I'm most excited about going to Yale is being able to work with Kerri, with Chris, with Dean Rani, with Nelba. That's really it, right? Like the pleasure of work is working with people who care, who are committed to doing good for the world. And it's such a privilege to have that opportunity, right? Like how many people can say that they have that opportunity? So that for me is also like such a pleasure.
That's awesome. Chris?
I anchor myself care in my faith. I take joy in the spiritual disciplines of and the practice that comes with that too. So taking time every week to lie fallow, I find that to be really powerful and really helpful to the work, even though that's not the main intention. And so that's something that gives me joy and strength.
proud to say I work in this group. It's a real privilege, and thank you to you for spending your time with me today. If you want to find out more about the firearm injury prevention work here at Yale, just drop those words into your browser and the website will come up, Firearm Injury Prevention at Yale, and you can even look up Dr. Magda Cerda, Dr. Kerri Raissian, and Dr. Chris Morrison. Right on the website, you can click their bio, their contact information is there. If you have questions, a lot is available online, thankfully. Thank you again for spending time with me, and I really look forward to what this year will bring. Again, you are the manifestation of Dean Rennie's hope and her vision forward, and we've got a lot to do. But we're going to have some fun doing it as well. Thank you so much.
Well,
Thank you.
we have to also end with that you are part of that dream too, Nelba.
Yes,
And that it is
absolutely.
Well,
a
I know, I get it,
pleasure
but
and
I was
honor
already
to
here
work
when we were sharing, so I'm good. We're good. We got this. They all know. My audience knows. Thank you.
Well, I want them to know you know.
Thank you. I do know that. There is just so much respect for community and all of the members of this team. And, I don't think this is actually my first time. Magda, I think these people know, but I don't think you know. This is my first time re-engaging in gun violence prevention since 2013. And it's
wow. I
only
did not know
because it feels safe enough to do it. And it is a big honor to be here among you all. So thank you. Thank you so much.
Somewhere in America, a phone is about to ring.